intensity ultrasound is effectively what it says. So it's very low frequency, low energy sound waves, which are generated by a special machine. And those sound waves are very safely then, with the use of an applicator, such as this, applied to the body. And those sound waves then gently cause secondary effects within the body to help regenerate its problems. It's very useful in urology in a number of conditions which affect men, such as erectile dysfunction, Peyronie's disease, and chronic prostatitis or chronic pelvic pain syndrome. So in men's health or urology, low intensity ultrasound can be used in a number of different treatment algorithms, but the main things it's used for are either erectile dysfunction, which is where men have either a difficulty getting, keeping, or both. And this affects up to 40% of all men at different age groups. The second option where it's very, very helpful is something called Peyronie's disease. This affects up to 10% of all men. It is characterized by bending of the penis, erectile dysfunction, and penile shortening. And often it's precipitated by an injury during sexual activity. And it is low intensity ultrasound can be very helpful in making this slow down in the acute phase and reduce curvature in the chronic phase. And the third thing where it's very helpful potentially in urology is something called chronic prostatitis or pelvic pain syndrome. This is a syndrome characterized by either pain on passing urine, pelvic pain, or pain on ejaculation, and can be very, very difficult to treat by traditional methods. Whereas low intensity ultrasound is used to try and reduce the inflammation in the prostate and can be very effective using a very non-invasive method. So low intensity ultrasound is suitable for most patients who have problems with erectile dysfunction. So erectile dysfunction can be caused by a number of problems. The commonest is a problem with the blood flow. So we call that vasculogenic ED. Certainly in that subgroup, it's very, very helpful. And what it does, it works by releasing growth factors within the body, which causes new blood vessel formation. That's something called neovascularization. So in that subgroup, it can improve erections in up to 60% of patients. But it can also be helpful in other subgroups of erectile dysfunction, such as those who've had prostate cancer, who've had diabetes or injury. But that data is evolving. It's also very helpful for Peyronie's disease, where there's a curvature. And what you end up doing is focusing the sound waves on the scar tissue. And what you're really trying to do is get the body to regenerate and heal itself by releasing growth factors and reduce the inflammation within the body. And in chronic prostatitis, patients are often treated with antibiotics, which are poorly effective, and other medical therapies. Other options are very, very invasive, whereas low intensity ultrasound for patients in chronic prostatitis, if you can localize where the pain is, you focus the ultrasound directly on that area to reduce the inflammation. So it's really very effective in those groups which have had lots of antibiotics and don't want to have very invasive treatments. So one of the major advantages of low intensity ultrasound, it is non-invasive. Okay, so it doesn't use any needles, you don't need an operation, you don't need an anesthetic. A lot of the treatments that we have for erectile dysfunction or Peyronie's disease or chronic prostatitis involve quite invasive methods. And despite that, the outcomes are not so good. So the biggest advantage of low intensity ultrasound, it's non-invasive, it's relatively painless, and there are minimal side effects. So low intensity ultrasound has been used for over 5 years around the world. So there's lots of good data to suggest the pros, the cons, and the side effects. The good news for patients is the side effects are absolutely minimal. So patients can experience a little bit of discomfort during the procedure and perhaps for a few days afterwards, but no long-term pain and no real discomfort at all. So it's a very low intensity, low frequency energy source, which causes minimal side effects. So patients can get results from the very first treatment. There are different protocols that we use depending on the patient, and we individualize the patient protocol for each patient. But in general, we do the treatment once a week. It takes between 20 and 30 minutes over a 6-week period. Some patients get improvement from the very first treatment, but most patients need 6 treatments to start getting some benefit. The benefit is usually slow and maximal at about 6 weeks following the last treatment.